So wanted to welcome you to my podcast officially.
Thank you.
Thank you for being here. You work on issues that are very common amongst my patients. I wanted to know what inspired you to become a physical therapist and then secondarily work with the type of patients that you work with.
Yeah. So prior to going to PT school, I was actually a surgical tech. So I worked in surgeries. I started doing mostly in vascular surgery. And in vascular surgery, we saw a lot of patients who were diabetic smokers. And so we'd be fixing some vessels and then they'd come back and there'd still be a problem and we'd see them again and again. I realized we were never giving people any sort of chance to address some of the things that were causing them to see us in the OR. Lifestyle changes and exercise and quitting smoking. Then I started working more in ortho and doing more back surgeries. We saw people for a laminectomy and then a fusion, and then they just keep coming back. And so same thing, we weren't giving people any tools to try and prevent coming to see us, basically. And we were selling surgery as a solution when really it was just treating symptoms. We're very robust humans. We don't just degenerate our spine. Well, our spine does degenerate over time because that's aging, but not to the point where it's pathological. And so something is causing that. There's a cause and effect. And I started shadowing some PTs and I was like, oh, this is how we change things. This is how we give people the opportunity to move better, help their body be healthy. And so they don't have to necessarily come see us for surgery. So that was progression to PT, going from kind of symptom fixing to actually looking at the root cause and fixing it from that perspective.
You primarily work with women?
I work with everyone. My passion is really making sure that I spread the word about how important strength training is specifically for women. You mentioned one of the other podcasts, you're speaking to someone about just how important aesthetics always seem to have been for the female population. I grew up mostly in the 90s where like waif culture was very big and being very thin and being a size 8 was too big. And so a lot of those paradigms have continued to carry on to today. And so now I see women who constantly were on self-feed diet and constantly calorie restricted. Carbs are bad and cardio, and not a lot of strength training for women. A lot of women who had hysterectomies early in life when they were having fibroids or bad periods and they were done having kids. I see a lot of women who had hysterectomies and oophorectomies or having their ovaries out too. And those are really important organs for estrogen production. And so when you see these women that had their uterus and ovaries out, because typically in the past too, they just took everything. You see a lot of repercussions from that with lower bone density in our women these days that had that done in their 30s, 40s. And so I see a lot of women now who, unfortunately, their DEXA scans aren't any good and they have osteopenia, osteoporosis, and then they also haven't been strength training because it's just not something that has been presented to them as either an option or really a necessity. And especially where I live, I do see a lot of people who are in their 50s and 60s, as well as I have two dichotomies. I see 50s and 60s, and I see a lot of professional cyclists and runners. And a lot of my older cyclists as well. Cycling is basically a non-weight bearing sport. So we see a lot of older women who have been riding for forever, but also are having issues with bone density. And then we talk also about just how important strength is for longevity as well. So all those things, as I see more people in my practice and I see the repercussions of social pressure to be thin and social pressure not to be bulky, God forbid, and just making sure that we get the word out there as to how important strength is, especially for my women.
You mentioned the 90s. It was in the 90s where the Women's Health Initiative came out and doctors and other practitioners stopped prescribing hormone replacement. So we now have a whole generation of women who were without estrogen replacement, and that definitely has affected their bone densities. So I think it's multiple factors. Plus, as you were mentioning, the cultural, the aesthetic part where women, unless women are taking steroids or they have some type of testosterone issue or they're getting exogenous testosterone, they're not going to bulk up. They will not bulk up. If you do strength training, yes, you will obviously tone more, but you will not bulk up. Many of your patients who have osteoporosis, what kind of regimen do you go through with them with osteoporosis, right? There's like a thinning of the bone, osteopenia, osteoporosis. So what kind of regimen do you go through them? That's like a number one question that patients ask when they're diagnosed with these conditions. What can they do? What exercises can they do? And I'm always surprised because they don't often understand what weight-bearing exercise means.
Comes to exactly how we treat osteopenia, osteoporosis. it's all about load tolerance. So typically there's a progression. So you're right in that when we say weight bearing, people are like, oh, a lot of my cyclists say this. Oh, I cycle. Yes, there is force, but there's not the actual ground reaction force of you hitting the ground that we need for actual bone density growth. And so what we typically start with is exactly that, is teaching people how to load their skeleton appropriately. Typically that's in sagittal plane, so not a lot of rotation or a lot of lateral movement to start, but really making sure the skeleton can actually accept axial load or load from basically the top down. A lot of education also has to come with how much weight we need to lift as well. Most people are underdosing themselves when it comes to weight. And so we typically there's a big range for muscle hypertrophy, which is typically first stage we go through, muscle growth. We need to be doing somewhere around 8 to 15 reps of something with 3 to 5 sets. And so I typically tend to try and get towards that lower end with a little bit higher weight because it tends to be most productive for muscle growth. Most people, what we should be seeing is when you're getting to that end of that set of reps. So let's say we're doing 8. That 6th, 7th, 8th rep should feel pretty darn hard. You should probably have to be slowing down to simply be able to create that force. So really a lot of times it comes down to teaching first what to do and then appropriate dosage as well. From there needs to be a progression. So there needs to be a progression to, if we can tolerate transverse motion, now making sure some people who do have really involved osteoporosis, we don't necessarily want to load a ton of transverse or lateral motion, but so it's patient appropriate. But working on teaching them how to move their spine in all directions because our spine takes force in all directions. A lot of times when these predominantly women have osteopenia, osteoporosis, they say, oh, don't bend down anymore. Don't flex your spine at all. And that's a pretty unreasonable request for people who have to tie their shoes, making sure that the spine is still robust enough to be able to at least have some sort of force. And then there's some interesting research coming out too about velocity and how important velocity can be for bone health. The last stage that I typically take my patients through is making sure we have some sort of velocity or speed-driven movement. They've found that speeds such as jumping, running, or plyometrics can be even more beneficial and more productive when it comes to improving bone density.
I think, this is all useful for my listeners to understand because, again, there's so much confusion around weight-bearing exercise and their regular cardio exercise. And from gauging, it doesn't necessarily sound like most of my patients are getting that true weight-bearing exercise that we desire. So a lot of people, as we were talking, they're afraid of bulking up. They're afraid that they might look bigger. So how do you overcome that resistance with your women patients? Try to convince them. Obviously, you speak with them just as I do, but what do you say to them that they realize that this is crucial or very important as they get older?
Yeah, and you're right. That is a really cultural mindset that is hard to break through. And so it depends on the patient. Some of them I can speak to it because yes, you're right. We are going to gain muscle mass. And the hardest part, I think, is not necessarily just the bulking up, but women being, unfortunately, worried of seeing changes on the scale because muscle weighs more than fat. Typically what I ask people too is when they come in and say, I gained, and always it's like, I gained 3 pounds. Nothing super substantial, but it can be. Emotionally speaking, 3 pounds can feel substantial. And typically my next question is, yeah, but do your pants feel better? Usually the answer is yes. So the change in our body can result in feeling better in our clothes, even though the numbers on the scale may look different. Secondly, as far as feeling bulky or seeming bulky, we do have to have significant load in order for muscle hypertrophy that is enough for there to be a aesthetic difference too. The other way sometimes I talk to patients about this is people becoming more concerned about longevity and health, speaking to people on the basis of health and how important strength is when it comes to longevity. Things like grip strength are a good marker of longevity. They found that people that have better grip strength live longer. The reason for that is not simply because people are doing hand exercise. The reason is because they're picking up heavy things. And so the mortality rate for people with hip fractures increases exponentially when we get to 70s, 80s, 90s. But something like 90% for 90-year-olds that get hip fracture or have a hip fracture within 1 year. You have to be lifting 3 to 4 times a week in order to really increase and at a heavy enough dose to increase muscle mass substantially. We do increase power and actual strength prior to that too. But in order to really gain a lot of muscle bulk, you have to be working for it, which is great if some people do want to do that. I love it. But I think also, luckily, the change in mentality has started to come in which people are thinking, oh, for longevity wise, oh, for strength wise, this is really important.
I recognize that. And I think it may be a function of just me getting older as well and hanging out with people who are now older as well, where we're talking about preserving our muscle mass, being able to live a healthier life. Whereas I remember when I was much younger, it was all about looking trim and being fit. So
Yeah,
it wasn't
you
necessarily
got.
about overall longevity. At least I don't remember at that time. But again, it could have just been a function of age. How do you gauge increases or even decreases in muscle mass in your patients? There are ways of gauging bone density, obviously, that practitioners use. But how do you assess that the muscle mass is increasing appropriately?
Yeah. Part of it is function, basically. So for my older adults, and there are actually a lot of standardized tests for our 60s, 70s, or 80s-year-olds regarding norms for those age groups for things like a sit-to-stand test. How many sit-to-stands, how many times can you rise from a chair without using your hand in 10 seconds? There's a 6-minute walk test in which how far can you travel in 6 minutes? So we can use some of those tests, again, because there are standardized norms to gauge where people are as far as what their fitness should be like. For me, because I see more active adults, I typically look more at and because I see people in PT mostly because they had some sort of pain, what causes their pain and what does that cause some of their movements to look like? So seeing how people do a squat or even a bridge or whatever it might be, that's a really good gauge for me to say, okay, what muscle groups may not be working as appropriately as we need them to? And what else do we need to make sure that they can do to increase that to the point where their work in here can match the function of what they need to be able to do. So things like, especially so my hikers, step ups are a really great example of like, how are they stepping up onto a higher surface? Or my cyclists, the single leg squats are a really good example of what they're doing. So a lot of it is how are they resisting the force of the ground or how are they performing the movement? Can give me a really good idea on what their overall strength is, as well as what muscle groups need the work individually.
Are there ever any tests? Because I know that some people get these fat muscle. I think it's called like a one company that does it is, I think it's called Body Sight or anything, something like that, where it's like a machine where you step up and it just does a scan of your body to determine the ratios. Do you ever use anything like that in your office?
I haven't used anything of that. I do have a colleague, a doctor in town who has something like that. So if I feel like that's appropriate, I can always refer them to them. A little less concerned about necessarily body mass percentages as far as muscle versus fat, and a little more about just how they use the muscles that they do have. But it is a nice parameter to have for sure.
They do exist. I think it's become more available
Yep.
to people. Especially, I think you can get them done at the gyms, some of the fancier gyms, and it's a good way to gauge. But I tell people not to necessarily get too wrapped up with it. I think it's good that you focus more on the function, right? Preserving function and obviously even increasing function. And I think that's a better way of gauging improvement in muscle mass. You may know that I focus a lot on women who are in their midlives. And part of that is menopause. So menopause, and we were talking a little bit about estrogen previously when it comes to removal of the ovaries. But with menopause, and the listeners know that there is a gradual decline in reproductive hormones such as estrogen. And you can even see that with testosterone as well during menopause. Do women in their menopausal years seek you out to help them with their health at this stage? Do you find that more often than, let's say, maybe 5 years ago?
Yeah, I would say there's definitely a lot more awareness of menopause, just what a huge health impact it is. I don't think women necessarily seek me out for that, but I do field a lot of questions from it because what we see a lot of times is decreases in strength. And so I'll have women come in and be like, hey, I'm really having a hard time with maintaining my lifts at the gym and I've got brain fog and I'm not sleeping very well. And all these things affect how our body feels and how we are able to generate force. And so a lot of times it's about talking about all of those other extraneous symptoms feel musculoskeletal related, but impact the musculoskeletal system. And so one of the things I talk a lot to my women about, and even actually starting in our 30s, again, if we talk about menopause and how we can, at least from a musculoskeletal perspective, try and mitigate some of the symptoms of that. This is why strength training becomes so important before we hit menopause too, because the more muscle mass we have prior to, the easier it is for us to, I should say easier, but it gives us a step up for maintaining some of that as we start to go through a lot of these symptoms and we see all these drops in hormones. Because you're right, testosterone is also one of the ones that start to drop for us too. So the big thing is making sure that I do, and I have a lot of great practitioners here that also treat a lot of women with menopause too, having that network of being able to make sure I can, when I see some, especially for women that maybe are appropriate for hormone replacement, but don't have anything or are really not sure where to go next or how to manage symptoms. I have a lot of providers that I can refer to as well so that we can make sure that we're looking at it from a holistic, comprehensive point of view and not just necessarily from more of a musculoskeletal point of view.
So tell me about your practice. Do you work with other physical therapists or do you work within a multi-specialty group?
Yep. So it's just me right now. So I've been in business 3 years now. Time flies when you're having fun. And I'm sure you've seen this as well too. I opened my practice so that I could treat the way I wanted to treat. We see that a lot of people's experience with physical therapy is going to what we call the PT mills, the ones with a ton of practitioners, and they see it for 20 minutes and they move you on. And we found that people don't necessarily get the best results from that either. And so my goal was to really make sure that I could treat patients one-to-one for an entire hour for as long as they need and really make sure that we can dive into some root causes. Because it turns out solving 30 years of back pain in 15 minutes is a pretty tough ask. Allows me the time to talk to my patients about menopause symptoms and other things that might be going on with their lives and all the other factors that are contributing to why they might be landing in my office because they had some sort of pain.
What other factors? We've touched a lot on menopause, but what other conditions do you see that lead to lower back pain and just deterioration in general?
Interestingly enough, if we talk about, again, from other aspects that contribute to when I see people with pain, with low back pain or whatever, they're not dissimilar to a lot of the things we see an increase in menopause. Stress is a huge one. Stress can really honestly increase pain symptoms because our body, how I always tell people is our body only has so many matches to burn in a day. And so if some of those matches are going to stress, we have less for our body to actually burn, treat pain or avoid pain or ignore their pain. And sometimes those inflammatory signals or those nervous system signals will actually elevate when we're in pain. Sleep's another big one. More and more research shows just how important sleep is for our body for recovery too. When we lack sleep, there's research that shows that less sleep will actually put athletes at a significantly higher risk for injuries. So our muscles and our body really need sleep as well. Nutrition is another one, making sure that we are just taking in a bunch of stuff that's maybe more harmful to the body, and whether that is alcohol or lots of sugar or just things that maybe our body doesn't love quite as much, that can really affect pain as well. Emotions and just social obligations too. I see a lot of, unfortunately, with these mothers who are busy taking care of their kids and having to get the family in order and still are responsible for a lot of the in-house responsibilities. And so it doesn't leave them a lot of time to be able to A, simply exercise to keep themselves moving, and B, if they do have pain, get their PT in as well. And so a lot of what I do too is making sure that we address all of those psychosocial factors as well, because they all have significant implications when it comes to pain.
You also have patients who are retired, yes? And
Yes.
so what do you frequently see amongst this population in terms of injuries, and what do you focus on to help them?
See a lot of low back pain, which is pretty common as we get older. Spine's done a lot of work for us by the time we hit 65. And I see a lot of that. A lot of times my progression for people is I'm lucky in that where I live in Prescott actually is a fairly big retirement community. We have a lot of retirees and then we have a lot of active cyclists and ultra runners actually. I'm lucky that I get to see both. And so the other lucky part about that is a lot of my retirees, this is a very big outdoor community. So a lot of them are hikers or cyclists. So they are still active. So it's a little bit of a, unfortunately, some of the more common aging population, but we still see a lot of the same pain points. So again, low back pain, neck pain is also really important. I see a lot of that. But with the low back pain, typically what I do is I take people through a progression. So I always explain it to my patients, like I have 4 phases of physical therapy. Typically what happens over time is our body will always choose the path of least resistance for most things. And so it gets really good at using our bigger muscles, our quads, our hamstrings, especially our paraspinals, our low backs, the big low back muscles. My hunters call them the backstrap muscles. And we tend to overuse those over time. And what happens is our body goes, oh, I can just use these for everything. I don't need to use those small stabilizing muscles. So what I've seen a lot of my patients is that over time, we've stopped using the smaller muscles that help stabilize the spine and the hips more. Those muscles rotate us. And as we get older, we rotate less. We're not playing on the playground. We're not playing sports. And so we tend to use them less. So a lot of times where we have to start is figuring out how to get some of those muscles to work in conjunction with some of the bigger muscles. Second step from that actually is then coordinating once we get those isolated muscles to work a little better for us. And then from there, we have to strengthen into those patterns. A lot of it comes down to muscle memory. The stronger we are, the more the body can remember the patterns it needs to use. And the fourth step there is what I call performance. So endurance, velocity, making sure my patients can get back to hiking the hikes they want to do, ride the rides they want to do, making sure they're back to full strength.
I've thrown a lot of different questions at you.
Love it.
Are there any topics that you'd like to talk about or anything that you're interested in that I haven't asked you about that we can include in this podcast?
That's a great question. I do see all populations, but as a female myself, I think I'm protective of my women. I think that we do have we have other needs, I think that's important. And I think one of the things I also see that I think might be important to point out to the female population is unfortunately, the kind of brushing off of female symptoms as well. So I see a lot of patients who have had pain for a long time. And I'm typically not their first stop. I'm typically someone they see later down the line. So I've seen a lot of patients who come to me and they were like, my doc said that nothing was really all that wrong with me, but I've been having this pain forever. Or my doc said my tests were fine and my x-ray looked good, but everything really hurts. Or they went to another PT and their PT said, ow, you're just not strong. And maybe that's part of it, but it's typically not the whole story. A lot of women I see come to me after they've gone several other places and been told their pain can't be changed or it can't be helped or whatever it might be. I had a patient yesterday, actually, that her x-ray, you can see her pelvis is rotated. And typically that'll happen if some muscles are pulling unevenly on your pelvis. And she's been told by several practitioners, can't change. That's just the way you are. And so then these thoughts get in your head of, I'm unchangeable. I'm unfixable. And so we hear that a lot of, I can't get fixed because this doctor told me. And really what we can do is change the tension on those muscles to change what your pelvis may or may not look like. Some things with like scoliosis, yes, we may not change the position of your pelvis, but if we just have a muscle imbalance, a lot of times we can change where your pelvis sits in space, basically. And small things like that are really important, I think, to make sure we can educate our patients on. There are things we can do to change the things that are bothering you. There are things we can do to address what you might be feeling. And what I always tell my patients, and I'm sure you're the same way, is even if I don't know why, we're going to figure it out. The answer is, okay, so this wasn't the right thing. Let's figure out why you're feeling what you're feeling. And I think that's an important part about it. I know this is not exclusive just to women, but I tend to see a lot of this in my female population.
I do too, unfortunately, almost on a daily basis. And not to say I'm that perfect doctor that it has always been able to figure things out and that everyone comes to me. At times I can be, but there are times when I can't figure it out. I do see more women than men with this. But again, as you said, this can happen to men as well.
Right.
But I think it's more frequent in women, to be honest with you.
Yeah.
Jessie, this has been a great conversation. Where can my patients find you if they want to look you up?
Yeah, my Instagram, which I'm actually very active on, I put a ton of information out there, is just Chain Reaction PT. I also have a newsletter that you can get to either on my link on my Instagram, or if you go to chainreactionpt.com, which is my website, chainreactionpt.com/newsletter if you want to get right there. It's a 2 times a month newsletter that I also put a ton of information out about PT, exercises, your body, just all the stuff. I do put out workouts as well, like easy, and they're all 20-minute workouts. Because again, we don't have a lot of the resistance I see also for strength training is time. And 20 minutes is enough to create change. And so if we can at least give people 20 minutes to work out and give them tools and the information what they need, I have all of those on my Instagram, and I also include one of my newsletters. So those are some really good ways to get some information. I do have a strength training program also available on my website. That's a 12-week self-paced strength training program. I created it for my cyclists because they in particular are resistant to strength training, because cycling is a long sport. You're out there for 3 hours. You don't have a lot of time to strength train. So same thing. The exercises or the workouts are all 20 to 40 minutes, and it gives people step-by-step instructions on how to strength train to do. Here are the workouts. I'm really happy with how that's turned out too for people. It turns out I had a lot of non-cyclists buy it too, and they've been really successful in it. So really, it's just a great strength training program for anyone that wants some direction. But the biggest thing really is my newsletter and my Instagram are the 2 places you can find me. So chainreactionpt.com and chainreactionpt on Instagram.
We'll make sure to include that in my show notes so that people
Thank you.
easily click that on the podcast as well as YouTube to look at all the fascinating information that you've shared with us.